This is Dr. Linda Ficociello, an epidemiologist at the Renal Research Institute. I'm here with my colleague, Dr. Zhang, a fellow epidemiologist, also from the Renal Research Institute, and Professor Kalantar-Zadeh, nephrologist and researcher from the Lundquist Center. We are here to discuss our recent CJSN article on mortality of patients initiating hemodialysis or hemodiafiltration. A prior landmark clinical study called the CONVINCE study found a 23% mortality risk reduction in patients treated with hemodiafiltration compared with hemodialysis. However, patients new to dialysis were not included.
In our current study, we included more than 18,000 end-stage kidney disease patients who were treated in immediate nephew care clinics. All patients were new to dialysis at baseline and were followed for an average of 16 months. After adjustment for differences in baseline characteristics, we found patients treated with hemodiafiltration experienced a 20% lower risk of all-cause mortality and a 29% lower risk of cardiovascular mortality compared to those treated with conventional hemodialysis.
ESKD patients in the early phase of dialysis face a much higher risk of illness and death. What this study suggests is that early adoption of hemodiafiltration could help reduce both overall and cardiovascular mortality. If confirmed, this could shape clinical guidelines and ultimately lead to meaningful survival gains at the stage when dialysis patients are most vulnerable.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.